Dr. Harrison Matthews, as an experienced oncologist with 30 years of experience, had seen thousands of patients. But when he had Kate Middleton's blood test results in his hands, he couldn't believe his eyes. He had the laboratory results checked 3 times, even had them verified by another hospital. The result was always the same. Nothing like this had ever been seen in medical literature before. "This is impossible, he murmured to himself. What was happening in Kate Middleton's body that would shock an experienced doctor so much? On the 7th floor of Royal Marsden Hospital, there was unusual activity in the early morning hours. Dr. Harrison Matthews had to start his shift at 6 a.m. instead of his usual 8 a.m. start time this morning. Night shift Dr. Sarah Collins had spoken on the phone in panic. "Harrison, you need to come urgently. Kate Middleton's blood results taken last night. There's something." Dr. Matthews had hastily finished his coffee and rushed to the hospital. In his 30 years of experience, being called urgently at night only happened in the most critical situations. Kate Middleton's condition was already sensitive: pancreatic cancer, stage 3, an aggressive tumor. But she had been responding very well to chemotherapy for the past 3 months. Walking through the hospital corridors, he was thinking about Kate's treatment process. When she was first diagnosed, the situation was very bad. The tumor was large and spreading rapidly. But Kate's determination had even impressed Dr. Matthews. She would come smiling before each session, joke with the nurses during treatment, and never complain. When he arrived at the laboratory, technician Amanda Clark greeted him with a worried face. Amanda had been working at this hospital for 15 years and had analyzed thousands of blood samples, but there was something different on her face today. "Dr. Matthews, we analyzed Kate Middleton's blood samples taken last night," said Amanda, with a tremor in her voice. "The results are not normal." Dr. Matthews took the file from Amanda's hands. At first glance, everything seemed normal. But when he looked at the numbers more closely, his eyebrows furrowed. "Is this correct?" asked Dr. Matthews, not taking his eyes off the paper. Amanda nodded. "We checked 3 times. We even tested with different machines. The result always comes out the same." Dr. Matthews took off his glasses, cleaned them, and looked at the results again. The papers in his hands were trembling. He had never seen such a thing in his 30 years of experience. "Amanda, who else has seen these results?" he asked with concern in his voice. "Only me and Dr. Rodriguez from the night shift." He was also very surprised. We even thought it might have been confused with another patient. Dr. Matthews couldn't believe the results. The cancer markers in Kate's blood had dropped dramatically. CA19-9 level had decreased from 890 units per milliliter 3 months ago to 45 units per milliliter. The normal value was below 37 units per milliliter, meaning Kate's values were approaching normal. "Amanda, bring Kate's previous results, Mal," said Dr. Matthews, "all of the last 3 months." Amanda pulled Kate's past tests from the computer. Dr. Matthews examined the numbers one by one. "This progression is impossible, Matt," murmured the doctor. "Such a drop in pancreatic cancer, especially this fast and regular." But this was just the beginning. When he looked at the other markers, his shock grew even greater. CEA level had dropped from 78 to 12, AFP level from 45 to 8. All cancer markers were approaching normal limits. "Amanda, don't share these results with anyone," said Dr. Matthews in a stern tone. "We need to fully understand the situation first." Amanda nodded. Dr. Matthews being this serious worried her. Dr. Matthews left the laboratory and went straight to the radiology department. He wanted to see Kate's latest MR results. If the blood results were correct, there should be changes in imaging as well. Radiology specialist Dr. Jennifer Park couldn't hide her astonishment while showing Kate's latest MR images to Dr. Matthews. "Harrison, I can't believe these images," said Dr. Park, "when I compare them with the MR from 3 months ago." Two images stood side by side on the screen. On the left, in the MRI from 3 months ago, a large tumor mass of 4.2 centimeters diameter was visible in Kate's pancreas. In the latest MR on the right, the tumor had almost disappeared. The size has decreased to 0.8 centimeters, explained Dr. Park. And the tissue density has also changed. It now looks more like fibrotic tissue rather than active cancer tissue. Dr. Matthews nodded, looking at the images. This was a very rarely seen condition in medicine, spontaneous regression, the shrinking of cancer on its own without any obvious reason. We also did a PET scan, said Dr. Park. Metabolic activity is almost zero. There seem to be no living cancer cells in the tumor tissue. These results were the most extraordinary situation, Doctor. Matthews had seen in his 30-year career. Dr. Matthews called other specialists within the hospital for an emergency meeting to fully understand the situation. Doctors from oncology, radiology, pathology, and hematology departments came together to evaluate Kate Middleton's case. At 2 p.m., 8 doctors gathered in the hospital administration's conference room. Dr. Matthews placed Kate's file on the table and took a deep breath. "My colleagues, I have called you today for a very extraordinary case," he began. Kate Middleton's condition presents a phenomenon very rarely seen in medical literature. There was tense silence in the meeting room. Dr. Matthews presented all of Kate's results. With each passing minute, the astonishment in the room increased. Radiology specialist Dr. Jennifer Park was the first to speak. "Harrison, I also examined these imaging results. A tumor dropping from 4.2 centimeters to 0.8 centimeters in 3 months. This is almost impossible for pancreatic cancer." Pathology specialist Dr. Michael Thompson shared the statistics in his hands. The spontaneous regression rate in pancreatic cancer is 0.2%. That means it's seen once in 500 cases, and it's usually not this dramatic. Only 12 similar cases are recorded in literature. Hematologist Dr. Susan Williams examined the blood results. "Look at the immune system markers," she said, showing the results to everyone at the table. NK cells and T lymphocyte activity is 3 times normal. The body is attacking cancer with its own immune system. Oncology specialist Dr. Robert Chen intervened. "I'm the one who planned Kate's chemotherapy. She was responding well to treatment, but this is far beyond what we expected." Dr. Matthews turned to endocrine specialist Dr. Lisa Zhang. "Lisa, is there any change in the hormonal profile?" Dr. Zhang looked at the test results in her hands. "Yes, very interesting. Cortisol levels are below normal, showing that stress hormones have dropped. Also, serotonin and dopamine levels are high. It's as if the body has entered optimal combat mode." Immunologist Dr. Maria Santos shared the most critical information. Cytotoxic T lymphocyte activity has increased by 400%. These cells specifically target cancer cells. It's as if the immune system recognized the cancer and is in full attack mode. These findings were very important. Kate's immune system had somehow recognized the cancer and aggressively attacked it. Dr. Matthews summarized the meeting. "So we have a spontaneous regression case very rarely seen in medical literature, but understanding the mechanism of this case could help other patients in the future." All doctors decided to develop a joint protocol to examine and research Kate's case in detail. Dr. Matthews went to Kate's room to explain the situation to her. Kate was sitting by the window, looking at the garden. The silk scarf on her head was shining in the sunlight. "Good morning, Kate, Nan," said Dr. Matthews as he entered the room. "I came to explain some test results to you." Kate turned, with a hopeful but worried expression on her face. "Bad news, doctor?" Dr. Matthews smiled. "No, quite the opposite, but very unexpected news." He showed Kate the blood results and imaging findings. Kate's eyes widened as she looked at the papers. "What does this mean?" asked Kate. It means the cancer has regressed significantly, said Dr. Matthews. Your body is somehow fighting an incredible battle against cancer. Kate's eyes teared up. So, am I getting better? The situation is very positive, but Kate, this is a very rarely seen condition in medicine. We need to understand this better. Dr. Matthews established a special team to research Kate's condition. He contacted immunology specialists worldwide. Special samples were taken from Kate's blood. Genetic analyses were performed. The results were surprising. There were unexpected increases in interleukin-2 and interferon gamma levels in Kate's immune system. This showed that the body's natural fighting system against cancer had become hyperactive. Active mutations were found in the p53 tumor suppressor gene in genetic analyses, explained genetic specialist Dr. Rachel Green. These mutations are protective against cancer. But the most interesting finding was in Kate's HLA type. This was a very rarely seen HLA combination that provided exceptional resistance against cancer. With Kate's permission, Dr. Matthews first shared the situation with the medical community in England, then worldwide. Harvard Medical School, Johns Hopkins, Mayo Clinic, the world's most prestigious medical institutions began to take interest in Kate's case. The first call came from Professor David Chen at Harvard Medical School. Dr. Matthews, I read your preliminary report about this case. Incredible. We urgently want to examine Kate's blood samples in our laboratory. The next day, Dr. Rebecca Martinez from Johns Hopkins Oncology Center called. Harrison, we've been waiting for such a spontaneous regression case for 25 years. Would you allow us to analyze Kate's immune profile? Dr. Michael Zhang from Stanford University presented a genetic perspective. Kate's HLA profile is extraordinary. In our genetic laboratory, we can develop personalized cancer vaccines based on her DNA. This could break new ground in immunotherapy research, said Professor David Chen from Harvard. If we can solve this mechanism in Kate's immune system, we can apply it to other patients as well. Researchers from MIT began developing new immunotherapy drugs from Kate's blood samples. These drugs could activate other cancer patients' immune systems similarly to Kate's. Interest from Europe was also great. Professor Elizabeth Thompson from Oxford University. This case should be the main project of the European Cancer Research Consortium. Professor Lars Andersson from Karolinska Institute. Even the Nobel Committee is following this case. If the spontaneous regression mechanism is solved, this would be a revolution. Dr. Matthews received communication from 156 research centers in 47 different countries in just 1 week. Kate's case had created a tsunami effect in the global medical community. When William learned about Kate's condition, he experienced both joy and astonishment. How is this possible? He asked Dr. Matthews. Sometimes miracles happen in medicine, said the doctor. Kate's condition is one of the rarest conditions we know. When the children George, Charlotte, and Lua learned that their mother was getting better, they experienced great joy. Kate explained the situation to them in simple terms. My body is fighting very hard to defeat the disease. King Charles was very moved when he learned about Kate's condition. During his own cancer battle, this news gave him hope too. Kate's extraordinary recovery caused great repercussions in the media, but Dr. Matthews and Kate decided to keep the medical details secret. Only the statement responding very well to treatment was made. Cancer patients and families worldwide took hope from Kate's condition. The #, Hope for Kate, trended on social media. But Dr. Matthews knew they needed to be careful. Kate's condition was very rare, and the same result couldn't be expected in every patient. Dr. Matthews documented Kate's case in detail. His article to be published in Nature Medicine journal aroused great interest in the medical world. Based on Kate's immune system profile, new diagnostic tests were developed. These tests could predict in advance which patients might show spontaneous regression. Kate's case shows the power of personalized medicine, said Dr. Matthews. Each patient's genetic profile is different. treatment approaches should also be different. 6 months later, cancer had completely disappeared in Kate's control scans. PET scan, MR, blood tests, all were normal. In medical terminology, complete remission, complete remission. When Dr. Matthews called Kate for her final checkup, he found her very different. Her hair had grown back, there was a healthy color on her face. But most importantly, there was hope and joy of life in her eyes. "Doctor, I don't know how to thank you for this miracle," said Kate. "Kate, the miracle was inside you," said Dr. Matthews. "We just witnessed it." Dr. Matthews began new research based on Kate's case. Immunotherapy drugs that mimicked Kate's immune system profile were being developed. The first clinical trials showed promising results. Patients with immune responses similar to Kate's could fight their cancers more strongly. "Kate's story is not just an individual miracle," explained Dr. Matthews. "It could be the beginning of a new era in cancer treatment." After her recovery, Kate established a foundation supporting cancer research. This foundation, named Hope Foundation, funded spontaneous regression research. A year later, Dr. Matthews smiled while looking at Kate's final checkup results. All values were perfect. Kate had not only recovered, but had also given hope to thousands of other patients. Kate's story took its place in medical literature as the Middleton case. This case opened new horizons in immunotherapy research. When Dr. Matthews said this is impossible in the laboratory that morning, he didn't know that the limits of the possible would be redefined. Kate Middleton had not only recovered from cancer, but had also started a revolution in the medical world. This story tells about real cases that push the boundaries of modern medicine and the power of the immune system. Could this extraordinary recovery experienced by Kate Middleton give hope to millions of patients in the future? Do you believe in medical miracles? Share your thoughts about this story in the comments, and don't forget to subscribe to our channel.